The U.S. is urging health officials to be ready to roll out a coronavirus vaccine by November the 1st, just 2 days before the presidential election. The Centers for Disease Control and Prevention has asked states to remove red tape and allow vaccine distribution centers to be fully operational by the 1st of November. The move comes despite the fact that a vaccine hasn't been identified yet. 3 drug makers are in phase 3 clinical trials involving tens of thousands of participants. It usually takes months to verify a vaccine is safe. But the U.S. Food and Drug Administration says it might give emergency authorization even before trials end. Well, Simon Marks is joining us with the latest from Washington, D.C. Simon, it seems that the sense is that the CDC is confident, on track, it will be able to deliver a vaccine to distribute soon?
I think cautious would be the way of putting it, Jill. They're not expressing confidence. They are saying that it is possible that a vaccine may be ready for distribution, and therefore they're putting America's 50 states and their respective health departments on notice to get ready for that possibility, just as the United States government has pre-ordered millions of doses of vaccine from a couple of those companies that are now engaged in phase 3 trials. There seems to be particular optimism at the moment about the projects that are underway at Moderna and at Pfizer. Were they to prove positive results in human tests that are being conducted now and may soon be administered to frontline healthcare workers here, then President Trump has characterized this as Operation Warp Speed. That's the name of this vaccine development program that the government is sponsoring and encouraging, and he wants those companies and others to be in a position to produce that vaccine, if it's safe, at warp speed. But the real question is it safe, and is all of this being pushed through in accordance with a political timeline? There are many public health officials out there, including Dr. Anthony Fauci, a member of the president's coronavirus task force, widely respected public health official here in Washington, D.C., who cautioned yesterday that this mustn't be done in a hurry. This can't be done without clear proof that any vaccine is going to be not just effective, but safe.
Yeah, you mentioned the political timeline, Simon. The date set is November the 1st. That's just 2 days before the election is set to take place.
Well, I mean, I think that will come as a surprise to absolutely no one, Steve. President Trump has been predicting for weeks that there's going to be a vaccine available by the end of the year. In his Republican convention speech last week, he suggested that it might be available even sooner. His own Centers for Disease Control and the Food and Drug Administration has at various points during America's experience with COVID-19 yielded to political pressure from the White House on a whole variety of different issues, most recently America's testing regimen, but also, of course, the enormous dispute that has taken place in this city about hydroxychloroquine, a drug absolutely championed by President Donald Trump, even though the FDA has now pulled its authorization for hydroxychloroquine to be used on an emergency basis to treat COVID-19 because of fears about its safety. So the president's critics say he is trying to create an environment in which he will be able to say to the public, miracle, by election day, we've got a vaccine, everybody can now start to prepare to take it. The president's defenders say these vaccine projects are really making rapid progress at an unprecedented clip. And if they're able to produce a vaccine by the 1st of November, it would be ludicrous to steer them away from that goal, regardless of the coincidental nature of the timing.
Coincidental indeed. Thanks very much for that update. Simon Marks speaking to us from Washington, D.C.